many years. But this evening, we're going to speak about an alternative to CPAP therapy. I would assume that most of you that have joined us this evening likely are either using CPAP or have tried CPAP before in the past, but there's a new therapy that was FDA approved in 2014 that we're going to discuss, which I'm sure many of you have heard of. As Lori mentioned, to ask questions, hover down at the Q&A button, and you can submit your questions through that method, and then we'll try to address your questions towards the end. So as you know, obstructive sleep apnea is a very common sleep disorder. In essence, what happens is the back of the throat, the tongue, the soft palate relax when we go to sleep, when muscle relaxation occurs, and the airway ends up getting collapsed. And if you can see here in this picture, this is a soft palate, this is a tongue, and this is a section that we're referring to as your airway that's being blocked, right? Either you can have a complete blockage, which is typically when a person may wake up gasping or they're told they stop breathing, or it could even just be partial collapse. But you can see that you're not able to get enough airflow in either through the nasal passage or even through the mouth itself. It's estimated that about 20 million Americans currently have moderate to severe obstructive sleep apnea, so it is quite a common condition. This picture here just shows what we see during a sleep study. So you can see in this first apnea episode, this person ended up having an episode of either a complete collapse or closure of the airway or partial closure for about 47 seconds. And obviously, because they weren't taking a full breath in, their oxygen level dropped down to about 84%. The normal during sleep should be 88 and above. The second episode lasted significantly longer, almost 90 seconds. And you can see that as a result, their oxygen level dropped even lower. So that there is what increases the risk of cardiovascular disease and stroke and Alzheimer's is because of those repetitive drops in oxygen, because you're periodically not taking full breaths in. So health risks associated with untreated sleep apnea are quite significant. Of course, the obvious is fatigue, not getting good quality sleep, tiredness, diminished productivity for all of you that are working, or even just issues with short-term memory, concentration, and just day-to-day living. Snoring, of course, can affect the bed partner. Accident risk, so motor vehicle accidents is a common consequence of drowsy driving, and drowsy driving is one of the most common causes of motor vehicle accidents these days, and it's often related to untreated sleep apnea, as we've all seen in the media, especially with, before the pandemic, of course, with train conductors and bus drivers and all that were falling asleep and having these unfortunate accidents. And like I mentioned earlier, heart and brain health is greatly impacted by untreated sleep apnea. Can have a 2 to 3 times increased risk of atrial fibrillation, up to 3 times increased risk of heart attack, up to 4 times risk of stroke, or even up to 5 times increased risk for Alzheimer's disease because of untreated sleep apnea alone. So it's quite significant. So CPAP therapy is the gold standard for treating sleep apnea and has been actually for 40 years this year. It was FDA approved in 1981. So it provides excellent results because it's pressurized air. So it touches the entire airway and is able to spread and hold all the soft tissue open. And as long as a person is set to the correct pressure, they've got a mask that fits well and doesn't leak, and they're using it all night, it should provide good symptomatic treatment, but also objective control of the sleep apnea. But CPAP can be challenging for many individuals to use, and I use CPAP myself. I've had my own challenges with it. Fortunately, I was able to work through it, but I have many patients that unfortunately had multiple issues with tolerating CPAP, and despite how much effort we put in collectively to make it work, some folks, we just couldn't get it to work for multiple reasons. But the risks of untreated sleep apnea are quite significant, especially when you're in the moderate and severe category. So there's always been a dilemma. How do we treat this patient population effectively to mitigate their risk of having potential brain or heart issues or other long-term health consequences because of not being able to treat the sleep apnea? And Inspire came out in 2014, which I'll discuss next, but that has turned out to be a nice option for individuals in this category. Other current treatments for sleep apnea, which you may be aware of, are going to be oral appliance therapy, which is this image here on the upper right. It's a mouth guard that in essence dentists would make, and it helps to extend the lower jaw forward while you're sleeping. So it's attempting to prevent the jaw and the tongue from sliding backwards. But it's not very effective with moderate to severe cases of sleep apnea because you can only extend a person's jaw forward only by a few millimeters, and it may not necessarily be enough to overcome the tongue from still sliding back, or even the soft palate, like I showed in that first picture, from collapsing the airway as well. And there is a potential risk of causing TMJ discomfort and even bite changes as well. So there is some tolerance issues there too. Oops, sorry. Now, upper airway surgery also is considered, but it's, again, it's pretty aggressive surgery. So there is a surgery called maxillomandibular advancement where they will cut the jawbone and in essence try to bring the bony structure a bit further forward to try to help, physically keep the airway open. It's quite an aggressive surgery. And it's about 50% effective. And unfortunately, it's often considered a cosmetic surgery as well, but it can be very painful, up to about a 12-month recovery time. And the sleep apnea and snoring often can persist. And I've had 2 patients in 10 years that had it done, not necessarily because of sleep apnea, but because they had major TMJ issues and they happened to have sleep apnea. And when we tested them after surgery, after about a year of healing, it turned out both of them still continue to have sleep apnea, unfortunately, even after this major surgery. It did help their TMJ issues, but it unfortunately didn't help their sleep apnea. So it's a very aggressive procedure that doesn't really have, significant favorable results. So let's jump into Inspire therapy. So Inspire therapy is a treatment for individuals with moderate to severe obstructive sleep apnea, for individuals that are unable to tolerate CPAP or they don't get symptomatic improvement. What is it? It's a hypoglossal nerve stimulator. So in essence, the nerve that controls the tongue is called the hypoglossal nerve. The muscle or the tongue is called a hypoglossal muscle. So in essence, what the Inspire device does, as you can see in this picture on the right, you have an implant that's placed by ENT on the right upper chest wall. There's an electrode that's cuffed around the hypoglossal nerve, the nerve that controls the tongue. And then there's a little sensor right here that detects breathing movement that's placed over the 4th space between the ribs on the right chest wall. In essence, the way it works is that when you're sleeping, when the device is detecting your breathing, with each breath, the implant here sends a small little electrical impulse to activate the nerve for your tongue to move your tongue forward and open up your throat for you. So it proactively actually keeps the throat open while you're sleeping. So it actually prevents the apnea from actually occurring. So that's what this device is designed to do. It's a safe outpatient procedure. Like I mentioned, ENT are the ones that would implant the device. We as sleep physicians are the ones that are going to be obviously initially evaluating to see if you're a good candidate from a sleep apnea, sleep medicine perspective, but then we're the ones also that would activate the device and then make adjustments and make sure you're doing well, just like how we would do when we start you on CPAP therapy and see you long term. The recovery time after surgery is quite quick. Most of my patients that have had the Inspire implant, after about the first week, they were back to doing almost normal activity. And like I mentioned, we in sleep medicine are the ones that would activate and manage the implant long term. So it's inserted through 2 to 3 small 2-inch incisions. Typically, there's a 2-inch incision here where they would implant this device right here, which is the generator. Then there can be a second 2-inch incision right here where they insert the breathing sensor. And then there's a 2-inch incision here just below the right jawline where they attach the cuff around the hypoglossal nerve. There is a local ENT surgeon here that is actually doing a 2-incision approach as well, and hence why I wrote 2 to 3 incisions, where there's one just below the right jaw, and there's one here in the right upper chest for the implant. And then he's able to still insert this breathing sensor lead without having to put a 3rd incision, so which is nice. Like I said, recovery post-operatively is fast. The procedure on average takes about 2 hours, but from what I understand, most patients usually go home, after about a total of 4 to 6 hours in an outpatient surgery center. They're usually either advised over-the-counter pain medications or something like Celebrex, but typically not given anything stronger than that. And they can return to non-strenuous activity within a few days after surgery. A common question we get is, given that this is a pacemaker type implant, how long does a battery last? And Inspire's informed us that on average, the battery should last for at least 11 years. It could be a bit longer. And the difference is that with a pacemaker, it's running 24 hours a day, whereas with Inspire, you're actually only running it and using it at night. So you're basically saving, the battery for 2/3 of the day by not having it on. Others also get concerned, can I have an MRI? And the answer is yes, you can safely have an MRI of the head, neck, and extremities as well. And the system also allows us to keep track of how much you're using it, how long each night, what setting you're on. It doesn't quite track how well the sleep apnea is controlled, but from what I understand, Inspire is working on that technology. So hopefully in the next iteration or 2, we will be able to keep that information stored as well. So this video here is just going to show us an example of a patient in terms of how it works. So let me just go ahead and hit play. So he takes his remote control, hits the green button to turn it on. He holds it up to the implant, and that's what activates it. And like I said, with each breath, the device sends an impulse to move the tongue forward, as you can see there in that picture, in that video rather, sorry. So that's how it's opening up the airway. So it's activating the tongue to move forward proactively with each breath to allow the airway to remain open so you can take full breaths in. So that's how it's treating the sleep apnea, but the snoring as well. So here we're going to be able to show what happens with sleep apnea in a patient that doesn't have the implant, and then what happens with the implant turned on. So let's go to this first video here. So the first video shows what happens with the base of the tongue. So the black hole there that you're seeing is the airway. You can see how narrow the airway is and how it's being blocked off by the tongue relaxing backwards. This video here shows what happens with a soft palate in the setting of untreated sleep apnea. You can see that you really can't see the airway much at all. It's pretty much occluded by the soft palate. Same patient with Inspire now turned on. So let's see first what happens with the base of the tongue and how the tongue is being moved forward with the implant. It's the same exact patient. So just take a look, and this is the airway right here, the black hole. So there you go. You can see that with each breath, the device is sending an impulse to move the tongue forward. You can see how nicely the airway opens up with each impulse. And then here you can see how the soft palate opens up nicely as well. So again, you can see that the airway is being nicely held open with the impulse from the Inspire implant. So what are the eligibility requirements? Who's a candidate for Inspire? So you have to be at least 18 years of age or older. You must have been diagnosed with moderate to severe obstructive sleep apnea, which is defined numerically as having at least 15 episodes per hour to 65 episodes per hour, and should be typically within the last 2 years in terms of a documentation of the severity of your sleep apnea. Must have documentation of why you can't use CPAP or inability to tolerate it or just not having symptomatic improvement. And then also you have to have a proper airway anatomy exam, which is something that ENT themselves would do, where they would have to take a camera and look in your throat to make sure that while you're sleeping, that your throat is collapsing in a specific manner, i.e. the tongue is sliding backwards and the soft palate's collapsing, but the side walls of your throat are not collapsing. If the side walls collapse, then that can be an excluding factor for being a candidate for Inspire. And there's also a weight restriction as well. So your body mass index must be below 35 kilograms per meter squared. And these are all based upon the criteria that the FDA approved for this implant in 2014. And insurance companies are holding to these criteria very strictly. So how do we manage the Inspire patient, right? So like I mentioned, we typically are the ones in sleep medicine to evaluate and screen who would be appropriate candidate. Then we get the individual over to ENT, where ENT would do their airway exam to make sure anatomically you're a good candidate. 30 days after you're implanted is when we meet in clinic, we as in with sleep medicine, and that's when we turn the device on for the first time. And then after that, we typically see you every 2 weeks, but you'll be making adjustments on the remote itself with raising the voltage setting slowly based upon how you're feeling. And then about 3 months after we turn the device on is when we'll actually do the fine-tuning sleep study, where we'll have you spend the night and we'll determine exactly what voltage setting is needed to treat you so we can confirm objectively that the apnea is well controlled. But in that 3-month period from the time that you're activated until we do the study, majority of individuals will get to a level where they're starting to notice that I'm sleeping better, my snoring is gone, I'm feeling better rested. So it's not that you're going to be turned on and then still have untreated sleep apnea for 90 days. It's just objectively, we won't know until we do the sleep study exactly how well the sleep apnea is controlled. But at least in that 90-day period, as we're making adjustments, you should start noticing symptomatic improvement. And then after that, it's long-term care. See you about every 6 months. And make sure you're doing well symptomatically, make sure you're using it well when we download the remote control. And we'll periodically do a follow-up sleep study to confirm the apnea is controlled, given that the device doesn't allow us to measure how well the apnea is controlled. So like I mentioned, during the activation visit, that's when we actually determine a few settings. So we know exactly where to start the implant initially. So we start with looking to see what setting do you initially feel an impulse, then when do we see tongue movement. And that's how we know that this is where we're going to set the implant initially to get you started on it. We'll go over how to use the remote control. We'll review how we want you to slowly increase the setting every 2 to 4 nights based upon how you're feeling. Then review the follow-up schedule, which typically in our practice, we'll see everyone back about 2 to 3 weeks later in clinic to see how you're doing, but also to see what the report from the remote looks like. And if we have to make any setting adjustments on the implant, we have to do that in person. We can't do that remotely, unfortunately.
You can see the telemetry wand here placed over the device. That allows the physician to use the programmer to communicate with the patient. And all the physician did there was find the amplitude which provided effective and comfortable settings. The physician is also instructed to review the book one more time and make sure the patient has a good basic understanding of how to use the remote, and remind the patient that the book is the resource to use if they are unclear about the functionality of the sleep remote.
So that video just shows in essence what we do during the activation visit. Next, we're going to review the sleep study. So that's when we actually bring you in about 90 days after implantation, or activation rather, based upon the new guidelines, to be able to determine exactly what voltage do we need. So the goal of the study is kind of like how when we test you at CPAP, we confirm at what pressure with CPAP is needed to treat the apnea. Specifically with Inspire, we're trying to determine what exact voltage setting do we need to use to treat you specifically. But the good thing is that we'll already have an idea of where you're likely going to be based upon how you've been doing over the course of the 3 months before we did the actual study. This video will just kind of show how that process is done.
The telemetry wand allows the sleep technician to do the study completely from the control room. No need to interrupt the patient. And then you can see the tech will go here in just a minute, pick up the stylus, and in response to watching the sleep study, make a subtle adjustment in amplitude and hit save. That's it. Subtle adjustments in amplitude to get to the best amplitude to effectively treat that patient's sleep apnea. Very simple, very straightforward. That's what the sleep study is all about.
And then after that, we'll see you back in clinic to review the results of the study, of course, and make sure that you're set at the appropriate setting. So in terms of clinical reports and clinical studies, so there's over 100 peer-reviewed publications regarding the effectiveness of Inspire. The pivotal trial was published in 2014 in the New England Journal of Medicine, where they followed patients for a period of 12 months and noticed quite significant improvements, both in terms of how well the sleep apnea was objectively controlled, but also how well they were able to use the device on a nightly basis compared to what's standard with CPAP, but also improvements in the way they were sleeping and even their daytime alertness. Also, they've been following patients over the course of 5 years to see how those individuals are doing 12 months, 3 years, 5 years down the road, to make sure that these individuals that were implanted 5 years ago are still consistently doing well. And the data has been actually quite remarkable. And the individuals, their apneas are still well controlled, and they're still consistently reporting improvements in their daytime alertness. There's also an ADHERE registry where about 5,000 patients are going to be enrolled. Right now, I believe they've hit a target of about 50% of that number. But again, the goal being to monitor these individuals globally, both in Germany and other European sites in the US, to see how they're doing long term, so we can make sure that we're learning about these individuals, and if things need to be fine-tuned, then we can obviously learn from them. There is plenty of insurance coverage. I don't believe I've come across a patient with an insurance that was not able to get coverage. I believe I've had a couple where we did have to do, a medical appeal and a peer-to-peer, but even after that, we were still able to get things covered for the patient. So overall, in general, there's good insurance coverage, including for Medicare as well. So this here just shows the STAR trial. So like I said, in that pivotal trial, the one that was published in New England Journal, the average severity of the sleep apnea was about 29 events per hour. This was about 126 patients. 1 year, 3 year, and 5 years after they were implanted, you can see that with Inspire, they were having, after the first year, about 9 events per hour, and then at 3 and 5 years, they were down to 6 events per hour compared to an average of 29. So that was quite good. In terms of their level of daytime sleepiness, the average level of daytime sleepiness reported before they were implanted was 11. That's that Epworth sleepiness score that we often have you fill out when you come into our sleep clinics. So 11 is consistent with excessive daytime sleepiness, but you can see that 1 year to 5 years after being implanted, the average was consistent at 6, meaning that their daytime sleepiness was resolved with Inspire. So let me just review a couple of my own patients, and then we'll get Randy Livingston to join us as well. And actually, Randy was the one that really kind of convinced me that I really should start recommending this to my patients, because I honestly was on the fence about it for a number of years. And it wasn't until about 2019 that I believe I met Randy, and it was talking with him and hearing his own experience that really prompted me to really take that next step and say, you know what, I think I do need to start recommending this to patients. So I was quite hesitant, to be honest with you, in the very beginning. So Mrs. Gigi, she's a 76-year-old lady, my current patient. She was diagnosed with severe sleep apnea at stopping breathing about 37 times an hour. Her Epworth sleepiness score when I first met her, meaning how likely she was to fall asleep, was 20 out of 24, so extremely sleeping. And her daughter's a nurse, and daughter was mentioning to me on the call that, her sleep was very broken. She's sleeping all day long. She just struggles with fall asleep, eating her breakfast in the morning. She had tried using CPAP, but struggled because couldn't find a mask that fit well, which is a common issue for many people. She was implanted with Inspire on July 8th, last summer in 2020. And after doing multiple adjustments, we did her sleep study with Inspire on October 15th, 2020. At an amplitude of 2.6 volts. So that's the amount of power in essence that we're using to activate the nerve to move her tongue forward. She was only having 9 episodes of sleep apnea per hour, which was significant improvement over 37. And you can see that her ESS, or how likely she was to fall asleep after her sleep study, actually even before we did the sleep study, was down to 4 from 20. And clinically, when I was meeting her, even before we did the sleep study, she was, after the third visit, she was already noticing that she was sleeping through the night, waking up far less to go to the bathroom. She even has a history of Parkinson's, and she had noted that that wasn't causing much of an issue because she was getting better sleep. But she was actually sleeping 7-8 hours throughout the night and noticing that she was feeling better rested, but also noted that she wasn't falling asleep during the day. And her daughter made a very lovely comment that I have my mother back, because her mother was able to stay awake all day long. So that was a great response. And the patient herself has been very happy in the fact that she's not having to use a CPAP, and she's actually getting good sleep and feeling better rested. So Mrs. PT is another patient of mine. So she was diagnosed with moderately severe obstructive sleep apnea in 2016 with an AHI of 25 episodes an hour. So she came to me as a second opinion from another sleep center because she was still struggling. So I worked with her actually for a better part of about close to 3 years. And she was doing well with CPAP in the sense that she felt that she was sleeping better and feeling better rested with CPAP compared to not using CPAP. But just because of the contours of her face, we couldn't find a mask that was perfect. So she still had a little bit of mask leak that still kept disrupting her sleep. So she had to rely upon a sleep aid. And it was frustrating because she would still wake up a few times during the night, even though I wanted her to be able to sleep straight through the night. So after about 2 to 3 years of trying to find a mask that fit, we had to give up because we had tried all the masks that we could try. So we discussed about Inspire, and she decided to move forward. So she was implanted on June 26th of 2020. And we ended up doing her sleep study in November. It was a little bit of a delay just because of the pandemic. But during her sleep study, at an amplitude of 2.7 volts, she had only 1.3 episodes of sleep apnea, down from 25. So she had a remarkable result. And clinically, she stopped taking sleep aids. She's sleeping straight through the night and actually feeling even better rested than compared to when she was using CPAP, and definitely much better rested compared to not using any therapy. But so she was very happy because she was able to, put away the CPAP device. So, and she's sleeping well now. So let's talk about Randy Livingston. Randy, are you with us?
I am.
Yeah, great. Thank you. You want to tell the audience your story?
I do. Thank you. That's quite a shout out to me. It's amazing to me that to help doctors understand the benefit of this device. But yeah, I started on CPAP. And I struggled for 6 months, and I would rip the mask off every night. And then a couple months went by, and I heard about Inspire. So I was implanted December 15th of 2017 and activated January 10th, 2018. And it's been 3 years now. The surgery was fairly easy. I recovered in 3 or 4 days with just over-the-counter Advil. I went back to work on day 4, pretty much an office job. They don't want you to do anything heavy upper body wise for the first month. They want you to heal up really, really well. And then you get activated, and activation day is a real fun day. You're very excited, but Inspire is a journey. It's not a race. So you have to listen to the Inspire team and the doctor. They're going to tell you generally, if you're activated on a Monday, to go up a level every Monday. So you start at a low level and you work your way up. And this is part of the journey to get better, because you're actually training your body to work with the device. And after about 2 weeks, I started noticing I stopped taking naps after work. And about 5 weeks into the therapy, I was like, wow, this is amazing. I feel 10 years younger. And I just felt so much better. My mood was better, because sleep apnea gives you depression and makes you short-tempered. I started dreaming again, which is something I hadn't done in years, but I just lost track of it. I just didn't notice I stopped dreaming. And so the surgery and recovery was easy. And then, the most common question I get is, does the therapy hurt? Does it hurt when it activates? And you don't even notice it because you're sleeping, because it's a motor nerve and it just nudges your tongue and opens your airway slightly so you don't stop breathing. And another common question I get is, how is travel? Are there any issues with traveling? And there's no issues with traveling. You sail right through airports. And as a matter of fact, camping is a breeze with it, because you don't have to plug anything in. Somebody from Texas reached out to me today because with everything that's going on with the power grid in Texas. He wants to move to Inspire now because he couldn't use his CPAP because they hadn't had electricity in 3 days. So this is another benefit of Inspire of not needing electrical. The other thing that's great about Inspire is the remote is very programmable. So mine is set to give me a 30-minute delay. I fall asleep and it starts working. They can change that to a 15-minute delay if you fall asleep right away, or they can lengthen it. And it's got an auto shut off. So mine's set for 8 hours, and then it automatically shuts off. If I get up out of bed earlier than the 8 hours, I can turn it off manually with the remote. So, I like to say Inspire saved my life, but it brought my life back because now I'm just living much more of an active life. And as a result of it, I actually lost some weight because I've been so much more active.
Oh, that's amazing. One question I have for you, Randy, given that you've had it for 3 years, so have you had to have the amplitude adjusted at all over the course of the last 3 years after your study?
No, I haven't. And the interesting thing is there's one night that I forgot to turn it on, and I felt horrible the next day. And so I know it's working because of that. And the way I feel so much different than I did 5 years ago. 5 years ago, I was dragging, and now I'm thriving.
That's amazing. That's really cool to hear. Like I said, honestly, I mean, you're the person that really changed my viewpoint on it, and it made me feel more comfortable to start recommending it. So I thank you for that. So but thank you for your story.
That's awesome.
Yeah. And you can see, everyone in the audience, you can see that Randy's baseline AHI, or the number of times that he was having sleep apnea events when he was first diagnosed, was 28 events per hour. And then once he had his sleep study with Inspire, it came down to 4 events per hour, which is great. So good result there objectively, and obviously from what he just told you, subjectively, he's had a fantastic result as well. So that's really good. So in terms of getting in touch with us, so there's 3 of us physicians here in our office, myself, Dr. Stacy Gunn, and Dr. Ramalingam, who's in our Gilbert office, but all of us are certified with Inspire to evaluate and manage patients. So here's our contact information. If any of you are interested in meeting with us to further discuss to see if you're an appropriate candidate for Inspire and just to learn more about it, we're happy to meet with you and discuss anything you may want to learn further about it. And if you feel that it's an appropriate decision for you, then we can get you over to one of our ENT partners that are also certified by Inspire, and they can do their evaluation from a surgical anatomical perspective and make sure you're a good candidate as well. But yeah, feel free to give our office a call there, or even go to our website. You can submit an appointment request, or even email this email address as well. And like I mentioned, we have 2 different office locations, one in North Scottsdale and one in Gilbert as well. So and if we have any questions, I guess I'll have Lori take over from here.
Yeah, we have a couple of questions that have come in. So once again, if you have questions, just feel free to type them into the question box and submit them. Our first question is, how do you turn it off when you wake up?
So there's 2 different ways. So if you wake up in the middle of the night, say to go to the bathroom, all you do is take the remote and the big green button, you just hit it once and that will put it on pause. And that's one of the things that Randy was mentioning, is that we can set the duration for the pause time, meaning that you can say, all right, if I go to the bathroom once or twice during the night, I'm awake for no more than 5 minutes in total, then we can set the pause time for 5 minutes, meaning when you wake up, you take the remote, hit the green button on the remote to pause it, hold it up to the implant. It'll put it on a 5-minute pause. So it basically turns off or puts it on standby for 5 minutes. Go to the bathroom, come back, go to sleep. Once that 5 minutes is up, it'll automatically turn back on. If you're asking about how do I turn it off when I wake up in the morning, well, we can also set a therapy duration time. So if, for instance, you tell me that I sleep for 7 hours per night, so we can set a default on the implant itself that after 7 hours, it will automatically turn off. But if, for instance, you wake up, 6 hours later because you had to catch a flight, well, you can just manually turn it off with the remote itself as well. There's an off button on the remote and you just hold it up to the implant and it powers it off.
Awesome. Thank you, Dr. Patel. Next question is, would you still be able to talk with your spouse after you turn it on with the remote?
Well, it depends, right? Because if we set a 30-minute delay, meaning that you turn it on and there's a 30-minute delay from the time that you first turn it on until the implant activates, in that 30-minute period, it's not going to be doing anything. It's on standby. So yes, you can talk to your spouse at that time. But if the implant has already started activating the tongue to move forward, you're going to be talking to her with a lisp, or you're not going to be able to. She's not going to be able to understand you, or he's not going to be able to understand you. So, if it's on and it's moving your tongue forward, then you're not going to be able to talk properly. You definitely don't want to drink or eat. So the only time really you can talk with it is in that that delay time from the moment that you first turn on until it actually activates, and that's something that we can program as well.
Awesome, thanks, Dr. Patel. How many people have this device?
So correct me if I'm wrong, Lori, but I think it's probably upwards to about 12,000 now in the US. Is that right?
Correct.
Okay.
Mm-hmm. And locally in Arizona, we have about 275.
Okay. And I think in my practice, for me specifically, I think I have close to 30 to 40. Is that right, Lori?
Uh-huh.
Okay.
And the next question is, you mentioned they determine if a person is a candidate for this device. How do they determine that the tongue and throat are appropriate for the device?
So that's where ENT comes into play. So they do a procedure called a drug-induced sleep endoscopy. So in essence, they'll bring you into the outpatient surgery center. They'll put you on a propofol to just temporarily, have you go to sleep, and they'll put a camera down into your throat. And then that's how they're basically going to mimic what's happening with your airway when you're sleeping, is by putting you on propofol for a short period of time. And that's how they'll be able to visualize to see anatomically, are you a good candidate? And that's something that ENT themselves would have to do.
Great. What is the success rate of Inspire?
So the literature shows that it's about 75 to 85% effective in treating moderate to severe obstructive sleep apnea. And I showed the data there from the STAR trial and the 5-year follow-up, that even 5 years down the road, individuals are having, consistent improvement objectively in their sleep apnea, but also subjectively as well. And then Randy just shared with us, for the last 3 years, he hasn't had any changes in his amplitude or his voltage setting, and he still has been feeling symptomatically well from the time that he ended the study with the fine tuning and all. So that right there shows that long-term individuals are doing well. And there's actually more data as well, which I didn't show you, but there's more data showing that individuals on average are using Inspire therapy for at least an hour and a half longer per night than individuals do with CPAP therapy. And there's a multitude of reasons why, the CPAP numbers are lower. But in general, though, people are able to use Inspire for a longer duration of time because it's simple. You turn it on, go to sleep, and the device, takes care of the tongue movement while you're sleeping. So it's just simpler to use, right?
Mhm. Great. Who's the ENT you mentioned that installs the device?
So there's several here in the Scottsdale area. We work with Dr. Jordan Weiner, Dr. Christopher Likens. In the Gilbert area, we work with Dr. Vina Votz, but there's several more in the Phoenix area throughout the valley that are also certified by Inspire. But these are the ones that we work with just because they're in close proximity to our practice locations.
Great. What if it's not successful? Can they remove it without an issue?
They can. That's very uncommon for a patient to be explanted, as it's called. Lori, do you want to share any comments on that as well from an Inspire perspective?
Yeah, sure. So it is very rare, as you said. We have over 200 almost actually 300 patients here in Phoenix, and we only have one that we currently have to explant just due to not necessarily that it wasn't working, but Dr. Patel, we have that patient in common, you know who I'm talking about, but just because for other reasons, kind of psychiatric reasons. So we will work with you in depth to get your Inspire right for you. There's so many different kind of settings that we can do to exhaust everything, and we will work with you as long as you'll work with us to make sure we can get it perfect for just right for you.
Yeah.
Is the battery a lithium, and if needs changing, how is it done?
So the battery question, I'd have to defer to you in terms of if it's a lithium battery.
It's
but
not,
in terms, sorry, say that again.
not lithium.
Okay, so it's not a lithium battery. Do you know what kind it is? That I don't know.
I will find out for you, but
Okay.
We can find out, and I can respond to the patient that's asking this question directly.
Perfect. The way it's replaced is that ENT would have to remove the original 2-inch pacemaker that they put in, this little device here, if you can see on the screen. And because it's all a built-in one unit, so they'd have to just quickly remove it and then insert the new one. So just like how they would do for a cardiac pacemaker, typically for a cardiac pacemaker, they have to replace it once every 10 years because of the battery, but it'd be the same process in essence.
Thanks. Is there a way to stimulate the feeling of this device to know if you will be able to tolerate it in the long run?
Is the individual asking before they get the implant?
Yeah, I think a trial.
I don't believe so.
No, not yet.
Yeah.
And then can you get a replacement remote for different rooms or different houses?
Yeah, you can. Actually, that's a great question. I learned something new probably about 2-3 months ago. There actually is a way for you to purchase additional remotes from Inspire directly. So yeah, if you travel often, you want to keep one in your travel bag, yeah, that's available.
Fantastic. That is all of our questions. We got a lot of them tonight, Dr. Patel, so thank you so much. Oh, we got one more coming in. Would we get access to the recording for this evening? Yes, of course. I will go ahead and send out the recording to everyone that attended. So you can watch it again and have all the contact information as well for Dr. Patel.
Mm-hmm. And then we'll be posting this this talk on our website as well, so that way it's online as well. That's our practice website there on the screen, sleeplessinarizona.com, and you'll have access there as well. So we'll get it uploaded there too, so you also have access to watch and share.
Fantastic. Well, thank you so much for your time tonight, Dr. Patel. Randy, thank you for sharing your story. And Randy is also willing to chat with anyone. If anybody wants to reach out, for sure we can get you in touch with Randy. So you can definitely ask Dr. Patel and I can definitely get you in touch. So thank you, everybody. Have a wonderful night.
Great. Thank you, Lori. Thank you, Randy. Appreciate it. Thank you, everyone, for attending this evening. And if any questions, please let us know. Thank you.
Thank you.